So by far and away, the most common thing that people deal with is just a sore arm. And there are a lot of people who will get other effects from the vaccine that are more diffuse soreness, so just like achy muscles maybe the next day. And some people even feel like a mild fever and headaches with that. And those are pretty common. Not everybody has them, but enough people that I think it's a pretty common thing to even prepare for. Usually, the first dose for most people is a little bit milder than the second dose. And the reason for that is your body is starting to build up the antibodies to fight off the coronavirus. And actually, we kind of want to see a good response from your body because it tells us that we're getting a good antibody and a good protective neutralizing antibody that's going to help keep you from getting the coronavirus in the future. So I think it's important that you think about not just the terms that get used as overall protection, but thinking about it in two different ways. One, when we look at these, we think about the vaccine, how effective it is at immunity. And that means preventing you from actually getting the disease, right? So that's very different than just overall protection. Overall protection can also mean, well, does it also prevent you from dying from the disease, which COVID, it's one of the reasons this has been such a difficult disease. And then, of course, whether or not you get really sick and end up having long-term effects. So the answer to the first part about whether or not when you would actually have immunity, we really kind of try to stick to the overall moniker of immunity probably that is durable, meaning it's going to last. That immunity is going to happen about 2 weeks after your second dose. You are starting to get protection, though, protection in terms of reducing the chances that you're going to end up in the hospital and dying. That starts happening in a way we can kind of detect after about 2 weeks. That doesn't mean it's at that full protection level, but it does mean you have some protection. So it certainly wouldn't mean that you should kind of just go out and start doing things that you used to do before that would put you at high risk to begin with. What it does mean is that maybe you feel like you can breathe just a little bit easier, though still using a mask when you're doing it. So that's a good question. It is hard to determine. And right now, the good thing about the new types of technologies that are being used and how strong of a response we're getting in the studies really points towards us probably having good immunity that lasts over a year in terms of protecting us from being so sick that we require hospitalization or dying. And we probably will be needing boosters in the future, but as of right now, even though the virus has been mutating, all of the vaccines that are on the docket, including the Johnson & Johnson, the Pfizer, and the Moderna, provide significant protection that is unlikely to go away this year right now. Being able to say, will it be 12 years, 3 years? That's not something that I think you can say with any degree of certainty at this point.